What's up, everybody? It's the Agnosticator once again. I gotta tell you, I was watching Fox News the other day, and I didn't immediately want to kill myself. It looks like Tucker Carlson kind of figured out how to be a journalist, like, overnight. He had Paul Ryan on his show to discuss the new Republican healthcare bill, the replacement for Obamacare, and he really laid into him. Like, he was not he was not easy on him. Usually Fox News tends to go pretty easy on these guys. But let's take a look. It was actually a really good interview. Here we go.
This is nothing but a win for conservatives.
Well, okay, so let's get to the tax policy. So as I understand it, and I'm just reading this, so I may have it wrong, but there's an investment tax in here, the net investment income tax. And as far as I know, it only kicks in on couples making over $250,000 a year. So it's a tax on wealthy investors, and you're eliminating it in a health care
3.8% tax. Yeah,
that's exactly right. So I guess my question is, looking at the last election, was the message of that election really, we need to help investors? I mean, the Dow is over 20,000. Are they really the group that needs the help?
Wow. That's coming from Fox News. That's coming from Tucker Carlson. A white dude named Tucker realizes that the message of the last election of Donald Trump was not, let's help the investors. Let's help the people who are already insanely rich. Let's help the working class. Let's help the blue-collar workers. Let's help the little guy. That was the message of Trump's election. And Tucker understands this. The rest of the Republicans don't. I mean, who would expect them to, though? They are the party that is more interested in helping out the rich than in helping out the working class and the working poor, the people who overwhelmingly voted Donald Trump.
This was a tax on capital income, which is bad for economic growth. It's basically a capital gains tax increase, effectively, to finance Obamacare. We're undoing Obamacare, so we're not going to keep Obamacare taxes in place. So all of these taxes, $1 trillion tax cut that this bill represents, that is part of that $1 trillion tax increase that was in Obamacare to finance Obamacare.
No, I know, but
we're repealing. No, but we promised we would repeal the Obamacare taxes. This is one of the Obamacare taxes, so we're keeping our promise. And by the way, it's bad tax policy because it's bad for economic growth, and we're also repealing the Obamacare spending. So we're getting rid of its taxing, and we're getting rid of its spending, and this is us keeping our...
Can I just say, I love the look on Tucker's face right here. He's like so confused. He has no idea what's going on.
Our word. You may want to keep that 3.8% tax. We're not going to keep it because it was part of Obamacare.
Well, but lots of things are part of Obamacare that you just said a minute ago you're not doing anything about because you can't under
only
reconciliation.
Because of
you don't have to meet. That's right. But you just said that you don't have to meet every promise in this first round.
That's right.
Yet, I guess it's a macro
but fiscal
question.
Policy we can be, but tax and spending policy we can. So that's what we're doing.
But also, I mean, you have. The overview here is that all the wealth basically in the last 10 years is stuck to the top end. That's one of the reasons we've had all this political turmoil, as you know. And so kind of a hard sell to say, yeah, we're going to repeal Obamacare, but we're going to send more money to the people who've already gotten the richest over the last 10 years. I mean, that's what this does, no?
Yeah, are we listening to Tucker Carlson or Bernie Sanders? He's talking about wealth concentration to the top echelon of people, to the top, 1%. If you want to use Bernie's terminology or reality's terminology, in that the last 10 years, last 20 years, 30 years, all this wealth has been concentrated to the absolute richest people in the world, in the country. So he's right there. This is just gonna exacerbate that. This is just gonna make it worse. And look at Paul Ryan's face. He knows it's true. He knows it's true. You can't fix the wealth inequality gap by bringing the taxes down on rich people. We know that trickle-down economics doesn't work. Supply-side economics doesn't work. We know that. We know that. And this is all this is. It's cutting taxes on the rich. And don't even call this a healthcare bill. This is a tax reform bill. Honestly. If you really look at it, the CBO just came out the other day, I think actually today, and said, no, it was yesterday, said that this bill will actually make it so that by 2028 or 2024, 24 million people will be uninsured, but it saves $337 billion. You're literally going to be taking insurance away from 24 million people. And another thing that they did, I didn't get an article for this, but they said that with defunding Planned Parenthood, you can expect more pregnancies and children coming into the system because adequate birth control is not going to be given to the people who need it. Not even just abortions, but birth control. These are people who aren't going to abort their babies if they get pregnant. So it's all around a disaster. It's not a healthcare bill. You're peeling away things of Obamacare that made Obamacare work. You're not keeping the individual mandate, though. You're penalizing people for not having insurance with a 30% surcharge. So you're literally, the people who can't afford insurance, you're going to be penalizing them even more than the Obamacare plan does, because they're going to have to pay 30% more on their insurance if they get insurance again after being uninsured. So you're getting rid of the individual mandate, but you're keeping the provision where people with pre-existing conditions are going to need to be covered. You're going to create a death spiral. Just the other day, Paul Ryan was talking about how you can't expect the healthy to subsidize the sick, but that's exactly how insurance works. This isn't an insurance bill. The Republicans don't care about insurance. They don't care about you and your health. They care about protecting their special interests and giving as many tax breaks to the super rich as humanly possible. This health bill, literally, the top 0.1% of people, top 0.1%, are going to receive a tax break of $200,000 per person. That's insane. You're cutting taxes like crazy, and you're taking healthcare away from people. It's not a healthcare bill. So let's hear what else Tucker has to say. Again, I just love Ryan's face there. It's great.
I'm not a leftist. It's just that's true.
I'm not a leftist. It's just that's true. Well, maybe you should be a leftist then, because our talking points are true. Your talking points are lies. So come on, Tucker. We will. You've been an asshole in the past, but we'll let bygones be bygones. Come to our side. We will accept you. It's okay. I know it's scary. You work for Fox News. You've always been conservative, but it's okay. We'll welcome you into the fold. Come on.
I'm not that concerned about it because we said we were going to repeal all the Obamacare taxes. This is one of the Obamacare taxes. The other point I'd say is this dramatically helps us toward tax reform. I know it gets a little wonky, but by getting rid of the Obamacare taxes, the next bill coming up this spring and summer is tax reform. And that means the new tax code that we're proposing, we put this in our Better Way plan too. It's a part of our blueprint. Go online and read that as well. That will not have to overcome those Obamacare taxes, meaning when we have a new replacement tax code to gut and replace this tax code, it won't have to also replace the Obamacare taxes. So by getting rid of all these taxes, we're lowering the revenue that is taken out of the American economy, out of families, out of businesses for the government, and we think that's really important.
So tell me, the individual mandate was the thing that most people dislike the most, I think, about Obamacare.
Right.
And I just want to make sure I understand this. So that's gone, but there's going to be a cost for late enrollment, and it's going to be, if I'm reading this right, 30% surcharge on the annual premium. So if a plan costs, say, $5,000 a year, that means you have to pay this extra $1,500 a year to pay the penalty.
Yeah, so let me explain why that is.
So why wouldn't I just wait till I get sick to buy insurance?
No,
and how is that?
Why indeed? You wouldn't, because you're not going to have the problem of not being insured because you have a pre-existing condition. So if I get cancer, it is overwhelmingly going to be cheaper than paying for my treatments to get insurance, even if I'm at a 30% surcharge. So I'm going to buy into the health insurance market when I get sick. I can save the money up front and not have to pay premiums because I'm not required to by law for a 30% surcharge if I were to get sick and get insurance. So doing that would be effectively gaming the system. And when you do it that way, only the sick people are going to have the motivation and the incentive to get insurance, and the healthy people are going to have the incentive to leave the market. And when you do that, like I said earlier, you get a death spiral in your health insurance. I'm telling you, within the next 5 years, if this plan goes through, our premiums are going to go absolutely insane through the roof. Unless, of course, we offload those costs onto older and sick people, which will probably be the way that they try to go about it, putting people back in high-risk pools, which will make them bankrupt because they can't afford their health insurance, and young people like me, I'll be fine. But that's okay to the Republicans.
That's the point. That's why we're tightening the enrollment period. We're having continuous coverage. And that's why Tom Price already put out a regulation saying we're not going to have an open enrollment period for a year. One of the reasons why Obamacare is collapsing and it's crashing and its prices are so high is because they had an open enrollment plan time for a year, which is exactly what you're saying is what is happening now. What we're trying to do is prevent that from happening so we can drop the price of health insurance. You can't just say to somebody, wait until you get sick, then buy the health care.
That's what you're saying. That's what the incentive is.
Do that, then the healthcare gets really expensive. That's what's happening now. This tightens that.
That's not what's happening now because people are required to have insurance. There's a mandate. You're getting rid of the mandate, you idiot.
So that we can drop the cost of health care. But gives people look, if you want to go from this plan to the next plan, by the way, in the employer market, they already have these rights. So what we're basically trying to do here, Tucker, is equalize the treatment and the fairness between people who get health care from jobs and people who don't. People who get health care from their work, they can move from plan to plan without any penalty. We want to just give people in the individual market, guys working $10, $15 an hour jobs that don't get health care at it, we want them to be able to be successful. We want them to be able to have the same kind of tax treatment everybody else gets so that they can get affordable care. This does that.
Okay.
This is nothing.
So that's honorable, right? If you want the little guy, the people who are making $10, $15 an hour, the union worker, the working poor to be successful and to have insurance, then go single payer. That's the option. That's the way to do it. The for-profit insurance is it's ridiculous. It's the stupidest thing on the planet. If you look at other OECD countries, we don't get any better health results or health outcomes. And we pay almost twice as much as anybody else in our GDP. When last I checked, it was 17% of the United States' GDP goes to health care, just paying health care. Other OECD countries, that's less than 10%. My friend Adam lives in Scotland, and they have the NHS, the National Health Service over there. They pay about 9% in GDP, and everything is free at point of service, no matter what it is. And yeah, you have the argument that you're rationing care. We are rationing care right now, except we're rationing it based on your wallet size, based on what you can afford. Over there, they're rationing it on basis of need. Okay? Healthcare, it has to be a fundamental human right. And the only way you're going to make the working poor successful, these people who are making $15 an hour, making them successful and making them have affordable health care is to go single payer and to put regulations in place and cost limiters in place for drugs and for services. The entire incentive of the American healthcare system is completely out of whack. It's got to change. And this healthcare bill is a disaster. It doesn't head in the right direction at all. So, good job, Tucker. Good job. And like I said, anytime you want to come over and join us liberals, you're welcome.